Hello and welcome to Prescription for Justice. My name is Martin Donohoe. My guest is Sam Metz, and we're talking about the U.S. healthcare system, what's wrong with it, and how it needs to be fixed. If you missed the last episode, you can watch it on YouTube, and I encourage you to, because we had an interesting discussion about the many ways in which the healthcare system in the United States is broken, the profitability that's immense of insurance and pharmaceutical companies, and started to delve into how to fix things. And Sam, I'm going to ask you at this point, what are the common characteristics of successful healthcare systems?
It's a great question. A successful healthcare system, as we discussed previously, provides access when needed, reduces cost, improves outcome. Mm-hmm. Better care to more people for less money, and in the industrialized world, we rank last. Mm-hmm. So what do these other countries have in common that we don't? Mm-hmm. They all do it differently. Don't believe what you read, what you hear on talk radio. It's not all socialized medicine out there. As a matter of fact, no country has a socialized medicine except Cuba. But what they all have in common is a universal health care plan. Now, that has some particular characteristics. Mm. It means everyone participates in a prepaid health care plan. No one can be excluded. No one can opt out. And you pay up front. You don't pay when you're sick. You pay up front. Second characteristic is comprehensive health care. Everyone has access to the same comprehensive health care. Comprehensive does not mean unlimited. Mm-hmm. It means treatable conditions get a treatment. It might not be the newest treatment, might not be the most expensive treatment, might not be an experimental treatment, might not be an unproven treatment. Every country, same comprehensive benefits. You can buy more supplemental policies if you have the money to do so, and you're welcome to do that. But you can't withhold money and get less.
But as an aside, that has led to some problems in the UK and Canada and elsewhere where people are allowed to buy their own private insurance. And I should emphasize just, you talked about not necessarily the latest treatment or the latest drug, which makes it sound like maybe under a single payer plan, people would not be getting state-of-the-art care. But the fact of the matter is that even with so-called state-of-the-art care in this country, which frankly all the European countries, Canada, Australia, all have, they have the same state-of-the-art care, we have worse outcomes. And we have 29 million people who die, or 29,000 people who die each year for lack of health care, which you're not seeing in those countries.
Yes, the biggest, I want to get back to that. There's a third characteristic of universal care, which is any patient can see any physician. And my payment as a physician is based on the value of the care I provide, not the value of the patient's insurance.
Good.
Yeah.
How did the Affordable Care Act change things in the United States? And before you answer that, I want to touch on something Sam said about the simplicity of a universal healthcare system. When the United Kingdom went to its single-payer program, the administrative costs were minuscule. People basically got a letter in the mail that said, check the following box, I'm a citizen of the United Kingdom, and then it said, if you've checked this box, you now have complete healthcare coverage. Compare and contrast that with the rollout of ObamaCare, which we'll talk about, which still leaves a lot of administrative bloat in the system, and the billions of dollars that were and are being wasted trying to get people to sign up for a variety of plans. So with that prequel, tell me a little bit about what ObamaCare did that was good and its weaknesses.
I really want to talk first about, I think, the most important point you made, which is administrative simplicity, which the Affordable Care Act did not alter. You mentioned the simplicity of getting health care in the UK. It's equally simple everywhere else because I'm a physician. Doesn't matter who my patient is. Mm-hmm. There's one policy, there's one form. Now, I might submit it to multiple I might have to submit it to multiple insurance companies because most of Central Europe and Japan use private insurance companies. Mm-hmm. But they all use the same form and it's the same benefits. Mm-hmm. In the United States, an estimate is the average primary care physician in Chicago might have to deal with 17,000 different schedules of benefits. And remember that every billable act has to be reviewed by an insurance company in the United States. 30% of them are denied. And then that insurance company changes almost every 2 or 3 years on average for every person. That is the administrative bloat that you're talking about. And that's not a small number.
Right. And I remember the leaders of Physicians for a National Health Program talked about a story about 10 years ago. They went to 2 hospitals, the Massachusetts General Hospital in Boston and Toronto General in Toronto in Canada, where they have a single payer system. In Mass General, they asked to see the billing department, and it took up an entire floor of the hospital and employed something like 950 people. They went to Toronto General, and most people didn't know where the billing department was. They finally found it. There were 2 part-time employees working in that office.
Yes. About 30% of a hospital budget is administration, that is trying to get paid for the work they do. That is 2 to 8 times what healthcare institutions in other countries provide. This means that if all we did was switch to a simplified billing system, that's the only thing we're going to do. We're just going to make sure in the United States, in Oregon, there's just one billing form and there's one schedule of benefits for everyone. We would recover enough money to pay for the unmet needs in the United States just by that alone. That's the beauty of a universal care plan. Now, about the Affordable Care Act, the Affordable Care Act did not change that administrative bloat, appropriate term. We are still the most expensive country in the world. Our public health, our medical outcomes are still the worst. On average, medical bankruptcies did not go down, and medical outcomes didn't improve, except when the Affordable Care Act finally kicked in, there was one set of patients who had fewer bankruptcies and better outcomes, and those were the patients who found themselves getting health care through the newly expanded Medicaid program. Now, these are patients who went from no care to Medicaid. Of course things are going to look better for them. But the rest of us who aren't on Medicaid did not see an improvement in outcomes or a reduction in bankruptcies, and we saw our health care costs continue to go up.
So fewer uninsured, but certainly not solving the problem, not getting rid of the insurance companies, and not allowing the federal government to negotiate for lower drug prices with the pharmaceutical industry through bulk purchasing. What were the other drawbacks of the Affordable Care Act?
The Affordable Care Act really was doing more of the same. It changed some of the rules, but the Affordable Care Act still left American health care as a zero-sum game. With the Affordable Care Act, just as before, the only way for one person to get more health care for less money is for somebody else to get less health care for more money.
So what's the difference, since we're throwing out these terms, between universal health care, single payer, socialized medicine?
It's a great question. Around the world, the industrialized world, there's 2 formats for healthcare. Most of the industrialized world uses universal healthcare. The U.S. uses chaos. So it's universal versus chaos. There's no other options. Within universal healthcare, with that single risk pool, everybody in, same policy, everybody, single network, there's 2 ways to pay for it. One is through private insurance companies. That's Central Europe and Japan. They still use the same billing form, same set of benefits, same set of physicians, in which people pay premiums that in turn pay their provider. The other option is single payer. Single payer is everybody pays taxes, which then pay their provider. Within single payer, you can have either private providers, like you and me, or have your care provided entirely by government employees. There's no industrialized country that provides care with just government employees. That's called socialized medicine. And in fact, In the world, there's only two examples of socialized medicine, where the government pays for all health care and the government provides all care. One is Cuba, the other is the Veterans Administration.
And the jails and prisons. One place, ironically, where you're guaranteed comprehensive care.
Yes. If you really want your health care costs to go down, don't pay taxes, don't pay premiums, let yourself get arrested for tax fraud, and then you can live tax-free at somebody else's expense in prison and have all of your health care paid for by the government.
Right.
It's a heck of a deal, but I don't recommend it. And other countries have figured out a way to do this without incarcerating everyone.
Yeah. And I think that term socialized medicine has the sort of whiff of communism attached to it, and that term really rose in popularity among the right during the Red Scare. And it was a way that even organized medicine like the AMA tried to brand single payer as a communist plot. But I think it's important to keep in mind that the government under single payer is not there making the decisions at the bedside of what your doctor can or cannot do. The doctor is funding, or the government is funding the program. The program is carried out, and I'm oversimplifying certainly a little bit here, but the program is carried out ideally by physicians, patient advocates, public health professionals, scientists, citizens, educators, who design the plan so that it optimizes the health care for the nation and it frees the individual from that fear of becoming uninsured with any unpredictable illness, becoming bankrupt, and then not getting care.
Yes, you mentioned several key topics. One is the slipperiness of the term socialized medicine. For example, it means whatever people want it to mean. For Democrats, it means whatever they do in England. For Republicans, it means what any plan proposed by a Democrat. And for highly paid medical specialists like me, it means any plan where I get paid less. Mm-hmm. We don't see that around the world. And in every other industrialized country, the person making your medical decisions is your physician. And your physician can make good or bad decisions, but they're all within the same nationwide context of what's available to you. In the United States, your medical decisions are made by two groups of people. One is your insurance administrator, who is legally beholden, as we've said, to the owners of the insurance company, for-profit or not-for-profit. The other people determining your benefits are U.S. Congress people, who are practically beholden to campaign donations so they can get reelected. Neither one of them, either practically or legally, can be concerned with my medical best interest.
Right.
The only one we can trust to do that is our physician, and we want our physician to get paid.
Right. And we want free communication with our physician, and ironically, despite the right wing wanting limited government and no interference of government in people's lives, they've tried to roll out initiatives having to do with counseling regarding reproductive health care, whether or not doctors can counsel about the dangers of guns in the home, and try to basically silence doctors. Not entirely successfully, and for instance, the Florida case relating to guns in the home. And the courts have held things up a little bit, but I would just add to that, we want those individuals out of the exam room. You want your interaction with your physician to be your physician to be private, and for the physician to be acting solely in your best interest.
We should be cautious about attributing bad motives solely to the right wing. Healthcare is being used to advance other agendas.
Right.
There are some people who say get government out of healthcare. Other people say get government into healthcare. Some people say get profit out of healthcare. Some people say get profit into healthcare. Some people say healthcare should be used to promote social obligations, other personal responsibility. It's being sidelined by people who are using healthcare as a tool to achieve some other political goal.
Right, and both sides of the aisle do that. You're absolutely correct. The Democrats take enormous amounts of money from the pharmaceutical and health insurance industries. So tell me, how would a single payer system work, and how can we pay for it?
Great question. First, we should realize that whether we're talking about the state of Oregon or nationwide, we already pay more than we need to provide comprehensive health care to everyone. We don't get it because we filter that money through insurance companies. If Americans were comfortable changing the name on the check, instead of writing a check to their insurance company, and all of the copays and all of the deductibles, they wrote that check to a single-payer agency, they would pay modestly less money than they're paying now, even though it would all be in taxes. Mm-hmm. They'd pay modestly less money, and they'd be guaranteed access when they need it. Medical bankruptcy would go away. Businesses could operate without worrying about strikes or lockouts over health care benefits. Right. And you could take a job with anybody you wanted, and you could keep your physician.
So this would be fantastic for the economy, too.
Oh, absolutely.
And I think you make an important point that on the whole it would be cheaper. It's just where you write your check. And for those interested in looking at the economic analyses of this, if you go to the Physicians for National Health Program website, they actually lay it out how it would be done to prove that these numbers are indeed correct. I find it a little bit interesting when people worry about, how can we trust the government to do this? And private industry is always more efficient, which we saw in our numbers earlier. It's not. The overhead for insurance companies is 20% versus 2 to 3% for Medicaid, Medicare. But I just have this innate moral feeling that there are some things that should not be subject to the marketplace, and that my health and my life is one of them.
We don't need to make the moral argument for single-payer health care or even for government-funded health care. When it comes to reducing the administrative costs of health care, in the U.S., government agencies are, depending upon the figures, 5 to 20 times more efficient than private health care. We've done the experiment. We know that it is far more expensive to have private insurance companies handle our money than Medicaid, Medicare, the VA, or any other government.
Or less efficient for them, the insurance companies.
Yes.
Yeah, I think you're right. And it's funny that many of the people who are adamantly opposed to single payer and want government's hands off of their health care might be over 65 and already getting Medicare. I think it's one of the analogies I use is, imagine if we privatized the fire department. And let's say your neighbor's house was on fire. And you called the fire department and said, hey, my neighbor's house is on fire. And you say, well, your house is not on fire yet. As if I've been exposed to tuberculosis, but you don't have tuberculosis yet. Well, your house is not on fire. Call us back when you have a problem. And then the neighbor calls and they say, well, we'll connect you with your fire insurance company. And they'll say, well, you have the pre-existing condition of a backyard barbecue on a wooden deck. And so if you want to give us $5,000 right up front, we'll come out to your house and put the fire out. But first we'll have to run this by prior authorization. And then by that time, your house is burned down, your neighbor's house is burned down, the whole block's burned down. Everybody's got a different fire insurance company. You've got 17 different private firehouses all in a small area. It just makes absolutely no sense to me.
Treating health care like an optional commodity, like a consumer good, comes up with absurd examples like you've just described. We get lower prices for flat screen televisions, for smartphones, for new cars. But if you don't get the new car that you want when you want it, a member of your family doesn't die. We should be treating health care like a public utility. Mm-hmm. Every household should have clean drinking water. We shouldn't charge people extra. We shouldn't have private companies charging us for drinking water, because what if you can't afford any drinking water? Mm-hmm. It's like power, like safe food in supermarkets, right, like schools, like police. It's one of the foundations of civilization. Mm-hmm. It's not a consumer good. If we treat it like a public utility, like a key part of our civilization, not only does our civilization benefit, do we have a healthier, more robust community, it costs us less money. That's the amazing part. We pay an extraordinary amount of money to preserve the most inefficient healthcare system in the world.
Right. And I understand your argument about not needing to make the moral argument to show that single payer is right. But I think if we're going to hold our nation up to the ideals put forward by its founders and by some of the heroes who've led things like the suffragist movement and the civil rights movement, we need to be better than this. We need to take care of ourselves and each other more than we are.
In his book, The Righteous Mind, Jonathan Haidt talks about different versions of morality and fairness. One version of fairness is everybody has equal access to essential social services. Another notion of fairness is proportionality. Small efforts get small rewards, big efforts get big rewards. They conflict with each other. Neither one of them is immoral. The point I would make is it doesn't matter which one of these moralities works with you. If you want your family to get access when you need it at a lower price with better outcomes, both of these groups are going to say, give us universal care.
So tell me a little bit about Physicians for National Health Program, Oregon Physicians for National Health Program, Mattis Health Doctors, and what our viewers can do.
First, you did mention the Physicians for National Health Program national website. That's simply pnhp.org. It's the best single source of information about healthcare policy in the U.S. It is a single-payer advocacy organization, but you will get the best information you can.
All based on published, peer-reviewed articles.
That is correct. This is not speculation.
Right.
These are not op-eds.
Right.
Second, there's a book by T.R. Reid, R-E-I-D, called The Healing of America, which I recommend. It's the best, most readable introduction to how the United States is so different from the rest of the world. Those two references will serve all of your viewers quite well. They're simple, relatively painless in a field that is so intimidatingly complex that you don't know where to start.
So now they got the information. What do they do with it?
All right. I have here in my pocket a weapon of mass destruction. Everyone out there can take out one of these and they can write a letter to their state legislator and to their U.S. Congresspeople. And the letter has 3 sentences. It says, this healthcare system has failed me, failed my family, failed my community, failed my clients, failed my business, whatever is relevant. Second sentence, I want you to provide access to me and my family when I need it and to everyone else in my community. Thirdly, tell me how you're going to do it. Sincerely, your voting constituent.
And even more powerful weapons of mass destruction based on statistics are your voice, make that phone call, and even better, show up in person. Your representatives work for you. They're here to take your concerns to the state and national legislature and get you what you want and need. So that's fantastic advice, Sam.
That's the best PS. After you've signed it, you say, when can we have coffee? And you can tell me what you're going to do about it.
Right. So I'm going to try to pull this together in some conclusions. I first want to thank you for coming on and sharing your wisdom with us, and I'd love to have you on again at some point in the future because there's a lot going on. I know that the Trump administration is trying to dismantle Obamacare with really nothing else in place. There are many in Congress, even among Republicans, who realize the time is coming for single payer, that it's the right and most efficient thing to do. And I think we'll see a lot happening. So there'll be a lot more to discuss. So just to reiterate, our country has a fragmented, expensive healthcare system which does not provide adequate care to millions and is made worse by unfair tax policies and inadequate funding of social services, causing immense suffering and death. There is a just, affordable, and more effective way to improve our health, and that is a single-payer system. Those who understand its workings best greatly prefer it. In all surveys, to our current non-system. We will get single payer someday. I know it. The question is, how many more must suffer and die before that day comes? So again, for more information, visit the website pnhp.org, or Physicians for a National Health Program. Feel free to join that or the Oregon chapter. These groups are not just for physicians. They're with anyone with a pulse who is concerned about how long that pulse is going to continue. You can also go to the Public Health and Social Justice website, where you can find numerous open access articles, PowerPoint slideshows, and by open access, I mean anyone can use all or part of a slideshow. Just make sure that you cite where you got it from. There is a slideshow on universal health care and single payer, which borrows liberally from the PNHP data. And again, our healthcare morass today kills. I want to remind people, with 28 million uninsured, 29,000 people die each year from lack of health insurance. That's about 7 9/11s each year. I'd like to see our government provide the same resources and passion to trying to save those lives as we've tried in combating terrorism. And I'll end with a quote from Martin Luther King Jr. "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." My thanks again to Dr. Sam Metz for joining us. Please get out there, and as Sam said, use that weapon of mass destruction that you can hold in your hand, the pen, the voice, your presence. Demand single payer. It's efficient, effective, cost-saving, helps everybody in, nobody out. We can do this. Thank you for joining us. My name is Martin Donohoe, and this has been Prescription for Justice. Please see our website on YouTube to watch all our other programs, as well as part 1 of this program. Have a good day.